United States Center for Disease Control has warned that Nigeria is at risk of vaccine-preventable diseases if urgent action is not taken against immunization gap. This is our focus today on sound health. I am Olasumbo Modupe. The conversation begins after this short break. Please stay tuned.
In 1974, WHO launched the expanded program on immunization to ensure all children in all countries benefit from the life-saving power of vaccines. Initially, for 6 major diseases: diphtheria, pertussis, tetanus, polio, measles, and tuberculosis. At the time, only about 10% of the world's children received 3 doses of DTP vaccine. Thanks to the expanded program on immunization, or EPI, it reached 86% in 2019, but has slipped since then owing to the disruptions of the COVID-19 pandemic and the very big campaign of anti-vaxxers. Today, more than 30 diseases are vaccine preventable. Vaccines are among the most powerful innovations in human history. Vaccines now give us hope of eliminating cervical cancer. Vaccines are helping us to snuff out Ebola outbreaks faster. For the first time, we can say that malaria is a vaccine-preventable disease. Vaccines were critical in ending COVID-19 as a global health emergency, and vaccines have brought us to the threshold of eradicating polio. Through WHO support of countries to ensure access to vaccines for all children, we're helping to avert more than 4 million doses every year.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Folake Kofo-idowu, an infectious diseases specialist and Chief Medical Officer IYEW, and she is going to tell us how to prevent vaccine-preventable diseases outbreak in Nigeria. Good evening, Dr. Kofo-idowu, and thanks for joining us.
Good evening, ma'am. Thank you for having me.
All right, thanks for having time to join us. Were you surprised when you got the news of the warning by the United States Center for Disease Control?
Not necessarily. I mean, there's been a lot of upheaval going on that's disrupting things, just the flow of people being able to get to hospitals and get things. So they definitely have certain information that may not be visible to the public that's informing that warning. So we just have to take heed.
Okay.
And next steps.
According to the Center for Disease Control in the USA, Nigeria accounts for 2.3 million zero-dose children. How did we get here, Dr. Kofo-idowu?
Well, I think one of the problems would definitely be the breakdown of primary care, because vaccination is at the lowest level. It's almost like the lowest level of governance, where you have the local government, and that's where vaccination is embedded in the primary healthcare center. According to going back a little bit, the Alma Ata, and then that prompted people like Professor, I think it was Olikoye Ransom Kuti, where they really established the Primary Care Health Act in the 80s. Nigeria had over 30,000 primary health care centers, and all over the country, most of them are not functional. There are definitely new programs that are coming up. I think there's an Adopt a facility that they're trying to get private organizations, foundations, individuals, organizations to adopt primary health centers so we can serve people, because these are the closest. So because of the breakdown of the systems and the functions of primary healthcare centers, this is why we cannot reach people in the closest places. There's a lot of geographical issues and transportation issues, where people getting from their remote areas far into maybe bigger hospitals or more functional primary healthcare centers, but the remote ones in the village, in distant areas, are not functional or are almost non-existent. So I think that's one of the huge contributing factors.
Okay, Dr. Kofo-idowu, let us take it further now. What are vaccine-preventable diseases? Because this program is solely to enlighten members of the public, to let them, it's all about health advocacy. Let us know what vaccine-preventable diseases are.
Vaccine-preventable diseases are communicable diseases, which means that you can contract it from another person, from an animal, or from non-living objects, right? So that's why they tell us when you cough or you sneeze, wash your hand, don't touch objects, because I could sneeze, touch a cup, go away, and somebody else carries that cup and they contract whatever it is I had. So vaccine preventable diseases are diseases that are a subset of communicable diseases. That's one. Now, there are so many communicable diseases, but not all of them are vaccine preventable. And another thing is to understand what a vaccine is. A vaccine is like a trainer. You give your body a sensitizer to train it, right, in readiness for the real thing. And that's really what a vaccine is. So you inoculate a person with a purified and tested protein anti-substance, right, chemical, and then your body sees, oh my god, this thing doesn't look normal, I'm supposed to do something. But what is interesting is that it looks like the disease entity, but it is not lethal, it is not deadly, or it is not in a dose that would cause harm. And so your body is able to have the capacity to now learn about it and develop a defense mechanism. So when the real thing comes, you now have a whole army that your body has trained in readiness specifically for that disease. So that's really what a vaccine does. And vaccine preventable diseases are just diseases that you can train your body to have a pre-known response towards.
Okay, the CDC gave some examples. They said polio, measles, and yellow fever outbreak are imminent. They also cited insecurity, far too rich communities as reasons for the wide gap in immunization. Let us start with the challenges why we are experiencing the wide gap in immunization before we talk about the diseases mentioned by the CDC.
Like I mentioned, we talk about breakdown. So one is funding. Over the decades, as we've seen, if you look at the healthcare budget for Nigeria, it's been low and almost abysmally low. And if you now look at the sub budget for, I think it's NPHCDA, is it enough, right, to be able to serve all the PHCs that are working, going to the local government? So one, funding is a big issue. Infrastructure is the next. You don't have enough facilities. The few facilities you have are non-functional, are substandard. Another issue is human capacity. It's very unfortunate that healthcare capacity is not easy to come by, it's not easy to acquire. It takes a long time to train a doctor. Just to be able to practice independently takes at least 7 years at the fastest. And we know Nigeria strike, all of those things. And then you're talking about nurses, you're talking about community health extension workers. It may be 2-3 years, but those are 2-3 significant. You can't just do a 6-month course and churn them out like that. So there is a dearth in the capacity. Our healthcare training institutions are not expanding in number enough to catch up with our growing population. That's one. So we're not putting enough influx of healthcare professionals, and yet we are experiencing a large emigration of healthcare workers outside the country. So once you can't match that, you can't bring in enough, and then you're losing, you're definitely going to keep experiencing a shortage. And all around the country, Nigerians more and more are losing trust for the orthodox healthcare system, for the government. The government is the one that is in charge and of PHCs running and vaccination and things like, and the trust is very shaky. It's very thin. Many times they have to do vaccine, and there has to be this massive, consistent, campaign, because yes, I mean, there are a lot of even educated countries that you also have to sensitize them. Their own issues are different, but our own also is that why do we can obviously see the consequences of these things much easily than the other people can, but we also need so much, because there's a lot of little bits and pieces of multifactorial, multifaceted rhetorics, religious, ethnic, tribal, all of these things, that so communication around healthcare and vaccination also has not been strong enough. We need to solve all these problems at the same time in different levels, and we also need to be consistent. And the communication for healthcare, for prevention, and for vaccination should be consistent, not just when there's an outbreak or when an outbreak. It should be part of our daily communication, such that it becomes a mantra in the heads of Nigerians.
Aside from insecurity, funding, infrastructure, limited infrastructure, it is sad to know that there are still over 2.3 children out there that have not received any vaccines. Are we looking at myth? Are we looking at misconceptions? Because gone were those days where our parents, they present us for vaccines within some certain periods before we get to the age of 5. But that is not existing anymore.
It's unfortunate. Times have changed. Times have changed a lot. The country has changed. The economic situation has changed. When we're looking at these things, in part, you also have to, and like you mentioned some of them, it's the social determinants, right? And a lot of this is economic. You talked about the insecurity. When people do not feel at peace, when people do not feel safe, when people are displaced, everything is upside down. Communities that are displaced, either by flood, insurgency, all of these things, what to be in point A is no longer existent, or now you have to travel to point A, B, C to be able to get the same thing. Yes, this person is struggling to drink water. So you want to tell the person who's struggling to find a place to sleep, find a place to get drinking water. You're not telling them about vaccine when they do not feel the imminent need. And that's one of the big problems with poverty, is that it blinds you to so many things. It blinds you to what is not in front of you, because you're trapped in this flight mode. And we're in more and more, day by day, Nigerians are thrown into this perpetual fright and flight. And so you do not have peace of mind. You do not have time to even think about what is not right in front of you. And that's just one of the big unfortunate issues that we're facing with that. Yes, I'm sure mothers would like to keep their children safe, and that's why I said the government has to respond, has to be agile in its response, and their response has to match what is going on. We are still treating these issues the same way we're treating them in the 80s and the 90s, right? Now, I don't see why primary health care should not be on the streets. Why they cannot hire large amounts and let them, because again, we have children who are out of school. So why is it's not unfathomable to have children who are not vaccinated. So imagine a child who's 6 years old has been walking the streets. Who's going to take him to get vaccinated? Maybe the last thing he got was when he was 3 months old, when his mother took him for follow-up or something like that. They are lost. Many of them have traveled miles and thousands of kilometers away from home. They don't know where their parents are. They don't know where their homes are. They've run away from home. So many things are happening. So the government has to be agile and dynamic in its response, in terms of they have to assess what is going on, have a team that keeps assessing. We have a lot of out of school children. You're trying to get them in school, but you know what? While we're trying to get them in school, let us also try to keep them healthy. Let us also try to get them food. There's nothing wrong with having, I don't know where, there's this program that finds kids, Oshodi Under Bridge and things like that. Can you have a feeding program there? Once you get them connected to food, you can get them connected to vaccines, you can get them. So it's about thinking outside the box to solve the problems, and you can solve many problems at once, and you can solve many determining factors also at once. But it takes will, sincerity of purpose, and commitment.
In 30 seconds now, your call to action, Dr. Kofo-idowu.
I think my call to action will be one to the citizens: be your brother's keepers and spread the word. Encourage your neighbors. If you see, children that you're suspecting, this child is not in school, this child is looking haggard, say something, right? It's not necessarily to get the parents in trouble, but to get them the necessary support. And next will be to the government, is that they just need to do better, and that's the bottom line. There's a multiple myriad of ways they can do better, and there's well-meaning Nigerians who have capacity to contribute in different ways, opinions, so many things. And the government just needs to step up and match the needs of the people and the needs of the situation right now to stem the problem.
Dr. Folake Kofo-idowu, Infectious Diseases Specialist and Chief Medical Officer, IYEW. Thank you so much for your expertise on vaccine-preventable disease in Nigeria.
Thank you very much, ma'am, for having me, and it was lovely joining you this evening.
Right, you're welcome. Sound Health continues with trending health reports from around the world. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment.
During my practice for the last 20 years, I have been seeing these black deposits on the lungs, which is an evidence of the air pollution outside. Air pollution impacts lungs in a very bad way. They are the portal of entry. The approach has to be preventing the air from getting polluted. And if we go into the causes, we realize that unrestricted use of fossil fuels, whether it is coal, whether it is oil, or it is gas, this is one of the major drivers of air pollution and climate change. So controlling the main source, that is fossil fuels, is the way to go. The price of air pollution is paid by our lungs.
Well, this is where we say thank you on today's episode of Sound Health. Diphtheria, monkeypox, or X are not 21st century diseases. They are vaccine-preventable diseases. Avail your children the opportunity to vaccinate against these diseases. Vaccines are safe, free, and harmless. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.